All right, man, listen up. Welcome back to Level the Playing Field. Today we're talking about an important subject as it pertains to men's health. You're going to get all three of these top tips I'm about to give y'all. Y'all listen and subscribe, follow along. I got great info for you. Let's get into it. So as y'all know, June is, Men's Health Awareness Month. And there's a lot of different ways you can take that for all kinds of different aspects of men's health that we really need to focus on. You could take it from the medical screening standpoint. You could take it from the mental health standpoint. Now, as y'all know, I focus on orthopedic surgery and sports medicine. We're gonna take it more from an orthopedic standpoint. So I'm gonna give y'all the top 3 things that I need you to focus on about hip mobility, your hip joints. So this gets overlooked a lot, especially for men, but I gotta tell you, just like the song says, hips don't lie. The hip is the center for almost every movement that you do in your life, all right, that hip joint. It pertains to you being able to walk, move, your lower back, how you do things day to day, being able to get out and move about in society. And so we oftentimes overlook the importance of the hip. So for my men out there, I really need you to understand these top 3 important things about the hip. But before I get into that, let me give you some background. Now the hip joint, it's kind of located down, you know where it is, where your back and your leg come together, right? And it's a ball and socket joint. Now around that ball and socket joint, you have a whole bunch of important muscles that stabilize and keep your hip, kind of set in place. A lot of people talk about things like the gluteus muscles, and you actually have 3 gluteus muscles that are important to you. You have your gluteus maximus, that's what everybody thinks about all the time. But you have 2 other smaller ones, the gluteus medius and the gluteus minimus. All right, and those 2 muscles are important for what we call hip abduction. Abduction, i.e. taking your leg away from midline. Think about like an alien abduction, taking it away. So the abductors, those 2 muscles, the gluteus medius and the minimus, they help pull your leg away from your midline. All right, so what's important about that is those abductors are actually key stabilizers of your pelvis. And your pelvis is really where your lower legs and your back come together. So you can imagine there's a lot important about that connection and keeping that connection strong. So what I see from a lot of my patients, especially, men who have kind of gotten to a phase where they're not sure what they're gonna do fitness wise in terms of staying active, is a lot of stiffness and immobility of their hip joints. And that leads to all kinds of other problems. So I'm gonna give you the first thing I need you to know about the hips. Hip mobility is tied to longevity. Hip mobility is tied to longevity. The more mobile your hips, the better chance you are of living a long and fulfilled life. And there's a few reasons for that. Hip mobility allows you to keep moving throughout your life. All right, so once again, like we said, the hip pretty much allows you to do all kinds of lower extremity or leg activity. So if you take it from a cardiovascular standpoint, y'all already know that cardiovascular health is importantly tied to how long you're gonna live, right? Heart health, lung health, and everything like that. But think about it this way. If your hips are immobile, if they're stiff, you're gonna have a tougher time doing things that allow you to keep your cardiovascular health up. All right, if you're into running, you're gonna have a tough time running if you're having hip immobility issues. If you're into even things like playing golf, you're gonna have a harder time doing things like that if your hips are causing you immobility problems. So hip mobility exercises are key to every man's health. Everyone should be doing some hip mobility every day. Now today's not the day I'm gonna go over the exact exercises, that's coming later, right? But you need to find a way to program that into your daily life and make it part of what you do in order to keep yourself moving, especially as we get older into our 30s, 40s, and 50s. Think about it as an investment. Every time you're doing the exercises, you're putting money in the bank, all right? And that strength and mobility is helping you later on. And again, we're focusing on those key muscles around your hip that keep you mobile. The gluteus medius, the minimus, the maximus. And we gotta always remember the core muscles too. All that ties together, but at the center of all that is the hips. So remember, hip mobility is tied to longevity. It keeps you moving, allows you to keep moving in society, which allows you to maintain your social connections. It keeps you outside if you're moving, right? So you can obtain vitamin D from the sun. Vitamin D from the sun, again, leads to all kinds of important things for your metabolism and keeping your health. It allows you to do cardiovascular activity, which keeps you overall young and healthy and keeps you mentally sharp. All these things all come together, and your hips are the center of all of that. So think hip mobility, longevity. Never forget that. The next thing is injury prevention. And that might seem kind of obvious, my hips are strong, therefore I won't hurt my hips. But you gotta think about this from a much larger perspective. So A lot of people have lower back pain, which again limits their ability to do things in daily life, be it things at work, be it things in sports they like to play, activities that they enjoy. Lower back pain is actually probably the most common cause for someone to go to the emergency room that's outside of the main, kind of emergency things you think of, like heart attack, stroke, and what have you. A lot of people go to the emergency room because the lower back hurts. A lot of lower back pain is not treatable through just exercise, that's true, but I see a lot of patients who have lower back pain because they're immobile elsewise. And the main place that they're immobile is in their hips. So strong hips take the pressure off of the rest of the system. If you have strong hips, you'll be able to, more effectively move the force from the top to the bottom of your body. And what that means is you're gonna be more effective in terms of how you walk, how you lift, how you do anything like that. Another thing to think about is that connection between your hips and your back will affect how your body responds to things like lifting heavy objects. So an example is if your hips are too stiff, immobile, or they're weak, too much force is gonna end up going through your lower back. You'll end up trying to move through your lower back when you're trying to, say, lift an object, right? That's increasing your risk for an injury. And even a simple relationship like that is enough to drastically change the trajectory of your life if you're doing things that involve you lifting daily, in and out, every day. So always keep in mind that the hips are key to keeping your back health. The hips are key to keeping your knee health too. People don't think about this, but a lot of patients who I see in the clinic have pain in their knees, which is actually related to weakness in their hips. Because what happens is they get weakness in those abductors. We said the gluteus, medius, and minimus. And too much force ends up going into the front of their knees. So a common complaint is, hey doc, it hurts when I sit too long. It hurts when I go down the stairs. It hurts when I'm sitting in the bleacher, watching my kids play sports, play ball or something like that. A lot of times, the first test that I do is check how strong your hip abductors are. In most cases, those people have profound weakness in the gluteus as it pertains to that, right? And so remembering that your hips is where the whole kinetic chain for your legs starts is important to knowing how you can avoid things like knee injuries, lower back injuries, all kinds of things. So again, relating the hip mobility to avoiding injuries. If you want to keep on doing what you want to do for longer, you've got to keep your hips mobile and strong. The last thing I'm going to talk to you, number 3, is bone health. Bone health is critical, again, to the first point, longevity. Bone health is important to keeping you moving throughout your life. Now, as you probably know, as we get older, we have a natural decrease in our bone density. It's just a natural thing that happens to all of us. So you starting off at a higher level of bone density is in your best interest for when you're later in life, to avoid all kinds of things like stress fractures, dreaded things like hip fractures. So how does that tie back to hip mobility? Well, once again, the more mobile and strong your hips are, the more you can exercise, the more you can stay on top of things like resistance exercise. Resistance exercise has been shown to dramatically increase your bone density. So think of it once again as an investment. In your 20s, 30s, and 40s, you are putting money in the bank by keeping your hips mobile and allowing for resistance training to strengthen up around your body. That resistance training is then also in turn helping with your bone density. You're putting money in the bank for your bone density because no matter what you do, it's gonna decrease as you get older, right? So you wanna get as much bone density as you possibly can when you're in your younger ages. Now, a big part of that is, of course, your diet, getting enough vitamin D, getting enough calcium, but a part that gets overlooked is your ability to stay on top of resistance exercises. And resistance exercises really don't work if you're having, pain throughout your joints, which you can prevent a lot of by working on your hip mobility. Hip mobility and strength are the keys to long-term orthopedic strength. And it gets overlooked way too much, especially for men. We don't think about our hips as much as we need to. So this month in June, I want y'all to go take this home with you and remember, every day, think about your hip mobility and your hip strength, remembering that that's the key to longevity and the key to maintaining a strong orthopedic life. Let's level the playing field, man. We got stuff like this for you every week, so stay on top of us, like and subscribe, and we'll see you next time.